So I'm Dr. Bassi. I'm an addiction psychiatrist, and I'm based out of Chicago, but I do exclusively virtual visits, so telepsychiatry. My practice name is called TeleHealth, and so I see patients in multiple states around the country, in California, Illinois, Florida, and Minnesota. And so I've been using Charm now for about 2 years. I have a staff of about 6 providers. I first looked into Charm about 2 years ago, and in my process of researching Charm, I looked at about 20 different EHRs. The features that I like most about Charm are its all-encompassing nature and its simplicity to use. And so my main priority was finding an EHR where I didn't have to go separately into a billing service and go separately into a scheduling service and then use a different e-prescribing service. And so this was all integrated in one system, one web page, simple, easy to do, and then for that matter, one team that I would be interacting with too. And since I do a lot of telepsychiatry and it had an integrated telepsychiatry or telehealth platform, that was also a huge plus for me. And the transparent pricing was also attractive because I was starting off my practice where it was just me and I didn't really know what my volume was. And so I didn't really want to pay for one of the larger companies, $300 a month when I didn't really know what my volume was. So Charm's pricing was quite attractive. I thought it was so usable, and when I was evaluating various EHRs, not only the number of features that they have is important, but just the usability in terms of like how intuitive are the features that you're interacting with. Like, are the things there that you would expect them to be there? And so I didn't really need an onboarding process. I had a few questions that came up along the way, but I just kind of got my feet wet, and when I needed a question answered, I reached out to Charm support, which was really helpful. It was very intuitive, and I think that's one of the strengths of Charm, because nobody really wants to do an onboarding process that's 8 hours long, which is typical in the field for various EHRs. You can easily spend 8 hours learning an EHR, but usability goes a long way here. It was fairly easy to train my staff to use Charm, and probably they had a pretty similar experience as me. So I had made some videos about pretty typical processes in using Charm, and then I would send them securely to my staff, and they would watch that process, and then that's pretty much all that was required for them to learn it. It was pretty easy to customize Charm, especially in terms of the navigation menus and the questionnaires where the patients initially reach out to our practice and using those questionnaires, and then once the encounter starts, making sure that all the things that you need in that encounter are there with quick text, and I use that feature quite a bit to reduce the amount of time typing something that you would have probably typed in every appointment. You could just do a quick text pretty easily. I use a number of Charm add-ons. I use probably the feature that I use the most is the text messaging feature. I also use the telehealth feature. Obviously, that's a Charm add-on. And so the text messaging reminders to remind the patients prior to the appointment, because that, the rate of no-shows and cancellations can be quite high in the field, and that in turn obviously reduces the revenue that you have coming in. And so if you need to pay, I think it's a very nominal amount for the text messaging feature, if that can potentially reduce a few no-shows, that easily pays for itself. And so we do take insurance, and that's also a very nice feature of Charm, because it basically covers the entire revenue cycle for patient coming into the practice. My experience using the patient health portal has been very positive. I'd say probably close to 100% of my patients use the patient portal. And so it's an easy, secure way to communicate with us and the rest of the staff in terms of just communicating in general questions and also requesting medication renewals, refills. And so it's very easy for us to communicate that way, and the patients find it also very easy to use the the patient health portal. And obviously it's more secure than using email, because email is not secure. And so any private practice needs to have some sort of patient health portal, and one that's easy to use goes a long way in improving patient satisfaction. My experience with Charm support has been great. I got to know Venki, I got to know Rao, I got to know Samba. So I'm all on first name basis with all of them, and they know me very well. And this is my first time actually meeting them in person at CHARMALOT 2019 in Tucson. And so they look down at my name badge and they say, "Dr. Bassi, oh, I know you so well." And that is by email, basically, and telephone calls. And we actually did a couple webinars together, and we have been working together very well. It's been a great experience. I would definitely recommend it to other psychiatrists like myself who are starting off, or therapists or counselors or psychologists who are starting off their practice, who have a small number of staff, because it helps reduce that overhead and that burden for ancillary staff. So it's very efficient to schedule patients and to get patients booked. And so you don't really need to have much ancillary staff. So for somebody who's first starting out, Charm is a very attractive option for them for that reason. So CHARMALOT 2019, this is my first year at CHARMALOT. It's been a great experience. I'm here at the Westin. Is beautiful. Tucson's really neat, and the weather is also really nice in December. And the presentations here have been really simplistic and easy to follow, and I think that the staff is all really supportive and friendly too. And so it's been really nice networking and conversing with other people in the area or other people in the field and getting to know one another. It's a very tight-knit community, and yeah, I've just been enjoying it so far here. Definitely would recommend it for those who have probably first started off using Charm, like kind of on the newer side of things. But even for an advanced user, I would say I'm fairly advanced user of Charm, and I've been using Charm now for 2 years, and there were a number of features that I didn't know about, and a number of questions that I was able to ask the engineers and the staff here. And so from that perspective, there's always something that you can learn from being at CHARMALOT. Even if you think you know everything, there's constantly new features that are being rolled out. And so making sure that you have those features incorporated into your practice to increase efficiency is definitely one big advantage to going to CHARMALOT and talking to the staff here about them.